led to any deviation in the county's commitment to safety. We deeply regret the situation and reinforce our strong commitment to the people of York County, our employees, and those in our homes. I want to also stress our strong and immediate commitment to resolving issues at the jail and our intent to take immediate action to uncover the situation, how the situation occurred, and how to ensure that best practices are being followed and will continue to be enforced going forward. I can assure you that we are working very closely with the Maine Centers for Disease Control and Prevention, the Maine Department of Corrections, and that our practices remain completely consistent with their recommendations. We will be engaging a third-party investigator with the Sheriff William King. He is not here on this press conference. As I'm sure you can imagine, our focus at this point has been on the safety and security of our inmates. We're going to continue to focus on these health issues and the well-being of our jail employees and their families. The inmates and the students of York County are all in our consideration. We understand that we're operating under some difficult circumstances. We have our commitment that we'll be addressing this in a very methodical, forthright, and rapid fashion. Before I go on to specific questions, I think it would be important to give you folks an indication as of what we believe our numbers are at this point in time. And I say believe because they do change based on the testing that comes in. And so my update to you as of 9:45 a.m. today, Monday, Thursday, the 3rd. So today we have 46 inmates testing positive, and we have 18 staff testing positive. 16 of those individuals are correctional staff. The other 2 are administrative in nature. We also have one outside vendor that tested positive. What we also understand, and what you may be saying as well, there appear to be more cases. We also understand and acknowledge that the CDC is also attributing those secondary and tertiary cases to us. And our understanding is, at this point in time, that 17 additional cases can be attributed to the outbreak at our facility. And that includes family members, roommates, and other close contacts. We're currently embarking on what we're calling our phase 3 or 3rd round of testing from the initial outbreak. We completed 3rd round testing on inmates yesterday, and we are working. We actually did the inmates on Tuesday, and we began our retesting for the 3rd round for employees yesterday, and we expect to finish that up today. With that being said, I am now going to open it, and in order to facilitate this, the questions, I'm just going to open it up. So anyone who wants to speak, go ahead. And I'm going to just ask while we're doing this for a little bit of understanding, as I'm trying to have a conversation with all of you folks here and allow additional participants coming in to make sure that we give them an opportunity to take part in this. So I'm available to answer something that you folks might have.
Sure. This is Patrick Whittle at Associated Press. Just want to make sure I understand. So we're up to a total of, it sounds like, 82 positive cases that are associated with the jail outbreak.
Yep, Patrick, I would agree with those numbers. Just doing quick math here. Yeah, again, I just want to just clarify and help you to understand. Those are our numbers. We're not looking to get in any type of disagreement with the CDC, again, with how the testing comes in. We may not necessarily know on those secondary or tertiary contacts, but that is our general understanding at this point in time.
And speaking of secondary, tertiary contacts, there's been the CDC has identified an overlap between this outbreak and the large Millinocket wedding outbreak. Is the jail or the county taking steps to investigate that as well?
We're not necessarily focused on, listen, we understand, and confirm that it was an individual associated with the wedding, an employee that brought it into the facility. Our role is to not investigate the outbreak that happened in Millinocket. That's for other authorities to review and investigate. Right. And so we're assisting and working collaboratively and cooperatively with the CDC and focusing on the outbreak at the county jail and trying to contain that issue.
So the investigation you're talking about then is York County government working in collaboration with the York Sheriff's Department.
Yes, what I'm referring to is our interest lies, from the beginning, the main focus of our response has been just that, our response. It has been focused on understanding the situation, taking whatever measures are necessary to continue to ensure the safety of all of those under our care, including employees. And, as we start to move into the third week of this, it is important that we start to acknowledge and review actions that had taken place and really conduct an inquiry into what happened. How did this happen at the facility with clear protocols in place?
The outbreak started on August 19th.
At the county facility, that is my understanding, yes.
Right. Thank you very much for all of that.
Zach Blanchard with News Center Maine. You talked about the protocols in place. Can you confirm that masks were not required in the facility early on? And if that was the case, should they have been, and should preventative steps have been taken to be checking temperatures and doing some screenings like that as well for staff coming in and out of the jail?
What I can confirm for you, Zach, is that protocols did exist. And we, I believe, share the same questions that you have. And that is the purpose of this particular investigation, is to understand, as I said in my statement, deviations from those protocols. That's what we're trying to understand.
One follow-up to that real quick. What is county government doing to support the families of these employees in the meantime, especially those who have contracted COVID as a result of their loved ones working in the facility?
Listen, we acknowledge that is occurring, and we are working with our employees. We have extended benefits to them while they are out taking care of their own issues associated with positive diagnosis. And we are also extending those benefits for additional leave, if need be, so that they can care for members of their family or other loved ones affected by this outbreak.
But isn't there a staffing shortage as a result? So or are you doing anything to address that issue?
Well, are we at a staffing shortage? And the global answer to that is yes, we as well as many other counties have an overall shortage for correctional officers. Since the pandemic began and various actions that were taken, we have seen our population decline at the jail. As of today, I'm giving you a rough estimate. I think we're at probably around 106 or 107 individuals over there that we're housing in the facility. Those are rough numbers based on my general understanding. Please don't commit me to a specific number, but we are at around 106 or 107. And so of those individuals, and since this began in March, we've seen our population as well as statewide in county facilities, our population has declined. And so as the population and number of inmates declined, so do the needs for staff and posts. And so I'm going to acknowledge that this is having an impact on our staffing. However, with the protocols that we have put in place and the methods that we're employing at the same time, we are able to keep up with our duty to man and staff the facility.
Thank you very much.
This is Susan Sharon from Maine Public Radio. I just have a question about how the prisoners are being treated inside the jail. How are they socially distanced, and what is their condition? How sick are they?
Sure. That's a great question, Sharon, and I probably should have touched on that when I gave you the update here. We're cautiously optimistic. We're not. We understand the situation. What I mean by that is, right now it's going very well. If that's an acceptable response here. Notwithstanding the outbreak, we have of the roughly 65 individuals directly involved at the jail. We're not talking about tertiary contacts because we're not necessarily fully involved with the tertiary contacts. We're aware of some symptoms that they might be having, but HIPAA regulations prevents us from getting that information direct. We are aware of 2 correctional officers that are having mild flu-like symptoms. We're monitoring them, and we call them on a daily basis to check in and understand how they're feeling. Our inmates, as of this morning, I am not aware of any inmates being in our medical unit. So I am aware that some of our inmates are also complaining of some symptoms associated with COVID-19, scratchy throat, some diarrhea, and perhaps a light fever or chills, but that is very small. Those inmates are in quarantine within the facility, and they are housed in single cells in what we'll call our enhanced medical unit. Those are where we're keeping positive inmates at this point in time. We're going to great extents to make sure, as we continue to work our way through this, we review our cohorting practices and how we house these individuals. So the inmates are, in my view, are being treated in a very fair and equitable manner. We're working with them and their attorneys, trying to get them what we'll call phone time so that they can make contact. As you can understand, because of this pandemic over there, there could be a little bit more liberal approach to the use of phones to communicate with outside individuals, including attorneys. to have a more methodical approach so that we limit the interaction of inmates and maintain the social distancing after which they walk. But we are doing that. We're working very hard to do that. And if somebody needs to contact them, we can call the jail main line and certainly assist with making that contact. So the inmates who are positive are in a separate unit, housed in single cells, and the other, what we would call close contact, are in another unit. And in some instances, they are in single cells, and in some instances, they are in a double cell. We do have a couple of units at the facility right now that, under the protocols that have been in place, we're not experiencing any positive symptoms coming out of, I believe it's about 2 of our pods. And so we're doing the best we can. We think we're doing a good job. And, you know, hopefully we'll begin to pull through this in another.
If I could follow up for the remaining prisoners who have not tested positive, I assume that there are steps being taken to keep them apart, but how can you ensure that they won't get sick, and could there be more, more consideration given to separating them or to releasing them in some fashion?
So, building on one of my prior answers, it's important to understand that the population overall at the jail is low. So, from a good news perspective, the individuals housed in other pods with we're very strongly and strictly enforcing social distancing. But in order to also maintain that, we are requiring a longer level of lockdown to help contain this. Now, that doesn't mean we're restricting direct time or anything like that. We are just looking at weird approaches, and other ways the folks on the bottom can have some time before the folks on the so we're doing what we need to do to try to maintain this social distancing. And, so far it's very well, and I believe everybody over there is very receptive to the practices that we're employing. We are concerned about the spread of the virus, and the protocols that we put in, donning full PPE and restricting very heavily access to units. Certain officers are assigned to one pod, and certain officers are assigned to another pod. So, hopefully that cross-contamination is something that we want to try to avoid.
Sir, Brad Rogers here from WGME 13. What about people who are arrested now? Are they being sent to a different facility, or is there, is there a safe place you feel for doing?
Sure. So, that's again another very good question. That's something and understand that issuing a simple directive to shut down the jail, we don't have that ability per se that a state facility would have because we're a very dynamic moving environment at the county level. So I am happy to say we did reach agreement with Cumberland particulars of how new arrestees transfers will be brought to Cumberland County, classification of those individuals and bringing them up. Those are issues that are literally being currently worked out right now. So I expect today, the good news is we are stemming the tide of new admits coming into the York County Jail. And feel that that is a major step for us in helping us to contain the outbreak.
Okay, thank you.
And everybody check their mute because it's killing the audio.
Hi, appreciate your speaking with us. This is Charlie Eichacker from the Bangor Daily News. Just to follow up on the new arrestees, I know you gave the number of around 106, 107 has been the rough inmate census, but sort of from the time the outbreak was identified, do you know how many new inmates have been admitted into the jail?
No, I cannot answer that question in terms of new admits. Anecdotally, what I can tell you is over this past weekend, the local police departments understand the situation up here, and I believe over this past weekend, we only had 3 new admits, and those were situations warranting an arrest. They were of a severe nature.
Hi, good morning, sir. This is Mary Kate from WMTW News 8.
Sure.
Asking a follow-up question from earlier. I know you mentioned looking into how there are protocols in the jail about face coverings, but wondering if you could confirm or not confirm if management didn't require inmates or staff to wear those protective face coverings.
Yeah, again, that's the operative question that I believe we all share. And so again, I'll reiterate, the county did have protocols in place. And part of what we're doing is undertaking a review to understand the decision-making process and what ultimately happened. We don't entirely know what led to the current situation. And so, we owe it to everybody involved to really understand the facts and the situation that may have led to a decision one way or the other. That is the million-dollar question. We know it is. We intend to get to the bottom of that.
Hi, Greg. This is Megan Gray from the Press Herald. Just to follow up on that, to make sure I'm understanding correctly. So under the protocols that the county has in place, would you have expected guards and inmates to be required to wear masks at all in jail?
The protocols of the county do call for face coverings, yes.
And as you conduct this inquiry, you touched a little bit on the current status, the symptoms that people are experiencing. What is the level of medical care that is available inside the jail, and at what point would you be required to seek outside care?
So I'm not going to be able to necessarily answer that full question, Megan. I will certainly get an answer for you. I can tell you that we have brought in some additional nursing staff to assist us and respond as needed. And so, however, at this point, I can report that we do not have any individuals at this point in time housed directly within our medical unit where they could receive some enhanced level of medical care. And if it got to a situation that we couldn't handle internally, we would certainly automatically bring them to one of our local hospitals down here.
Thank you.
Hi, and similar question. This is Charlie again at the Bangor Daily. Do you have protocols around temperature taking and screening questions for staff when they get to the jail?
We do now. As of August 19th, I'm fully aware that that is something that has been implemented. And again, countywide, it's something that we have been doing.
But, oh.
Sorry, go ahead, Charlie. I think you're going to ask the same question.
Right. Well, I was going to ask before 19, was there not a protocol, and do you know how the practice was, even if there wasn't a protocol of that?
That was something I'm going to have to look into, and again, something that we hope to review in terms of the inquiry that we're going to be conducting.
Hi, this is Dustin Lukowski from NECN. I wanted to ask if there is a protocol that was violated here, who bears responsibility for that? Is that the sheriff? Is that the government writ large for the county? Who would be that person?
Well, that's the operative question. And so again, as we embark on our review, it would really be speculative and presumptive of me to identify who would be in charge of the decision making. Certainly you have identified a few folks. That is the purpose of this investigation, to understand who ultimately made some decisions here and offered advice and suggestions on how protocols need to be moved forward, how they need to be interpreted in terms of where we go from here. But I'm not going to speculate on who we're going to be holding accountable at this point in time and or assigning blame. Again, I think collectively we all understand the severity of this situation, and we're going to be looking into this. I don't have a concrete answer for you as it pertains to this. I'm not trying to be evasive, but this is going to be a complicated process to have to work through so that we get all of the facts and information to help us come to the appropriate conclusion before any adverse action may be taken.
And then in the interim, while this facility, for however long, needs to be watched for the virus there, is there an alternative plan to move some of the functions into some other facilities, or how do you get by in the interim?
Yeah, again, we are getting by. We're doing it. The employees are stepping up. We couldn't do it without them. It's a great bunch of people over there. We appreciate the sacrifices that they're making to staff the facility. We do not need, at this point, to transfer inmates to another facility. Excuse me, to another facility. So we're managing the situation right now with the staff that we do have. Obviously, that could change from day to day, depending on where the tests come in. Are more officers going to test positive? We don't have an answer for that at this point. And so we are adapting and changing our practices on a daily basis to meet the demands and the requirements of housing our inmates.
I'm sorry, you may have addressed this before, but who is the third party that will be doing the inquiry?
Yes, we're currently looking and working with our council right now to assign an independent party. I don't have a specific name for you because we're starting that process. I expect to have that within a day or two.
Hi, Greg. Megan again from the Press Herald. You touched a moment ago on staffing, that you feel like you can staff the jail appropriately at this point. My memory from at least within the last couple weeks is that there were about half of the budgeted 75 or so corrections officers were vacant.
Yes.
And so there were, about 35 to 40 corrections officers employed at the jail. And now we've seen, as you said, 16 of them out because they've tested positive. So if you have, 20 to 25 corrections officers, are those officers working a lot of overtime right now? Are they pushing the limits of their contracted overtime? And at what level, what is the minimum number of, active employees that you need to safely staff the jail?
Okay, so there were a lot of questions there. I'm going to try to give you an overview that hopefully will answer some of your questions. And it looks like I got some people coming in. And so hopefully I can answer that for you. So you are correct. We budget for 76 correctional officers, and that assumes a staff or an inmate population of. It allows us to handle an inmate population of about 250 people. However, we don't have 250 inmates, and so we're at about 106 or 107. And so accordingly, the number of pods that were required to staff to keep individuals separate depending on their classification has been reduced. I can't speak to the number of pods that are open right now. I'm going to guess 4 are open, perhaps maybe 5 at this point in time. And so we are able to staff that at this point under our under methods of how we implement lockdowns, how we allow inmates rec time, what we call tiered lockdowns. So you are correct. We are suffering with our staff being out. But that being said, some of our officers are already through the quarantine period and have started to return. So while your numbers are correct, and we will continue to report the number of infected staff, which is 16. We are aware of 2 of them that have started to that have returned to the facility and are working. So it's not. It's important to understand how to interpret those numbers and what's actually happening here when the inmate count or the employee count goes up. A lot of those folks are getting to the point where they can begin to return to work. And we're aware of a few because of those tertiary cases that, probably won't be able to come back. And we're going to work with them on an individualized basis, day-to-day basis to assist them. The officers are working a lot of overtime. I'm sure you're hearing about it. The county has responded to this situation and have put necessary practices into place to assist them and mitigate the intense overtime that they're working. Officers right now can work up to a maximum of 72 hours. There are multiple officers that would like to exceed the 72 hours per week. We are acutely aware of officer fatigue, and we have made arrangements in our wellness center at the recommendation of several officers who live a little bit further away, that between shifts would be great if they had a private room. So we have 4 private rooms with bed linens and a shower. We will provide food if needed to individuals at our wellness center to help provide a respite outside of the facility. But make no doubt, we acknowledge they are working a lot of hours down there, and we greatly appreciate the effort that they are putting in.
Thanks very much. I appreciate you answering all those questions. I just have one more then. For someone to return to work after a positive test, what are you requiring of them? Do they have to test negative?
Sure. I'm not going to lie. The quarantine periods are a little bit difficult to understand because there's the asymptomatic that test positive, individuals that test positive that have symptoms. There's close contacts that require a 14-day period. But then in between here, when you have an asymptomatic individual who tested positive, of course, expressing a symptom perhaps on day 6 or 7, we believe the clock starts over again in terms of how and when we can bring them back to work. So the general rule of thumb that we're following is individuals who tested positive are able to return to work what would be on day 11. Individuals who test positive need to quarantine for 10 days. They can return on day 11. Close contacts associated with this, they can come back to work having a negative test and exercising all due diligence and mandatory requirements of donning full PPE because they are essential workers. We are doing this in these calculations in unison with the CDC. We're lockstep with them, and there are actually spreadsheets that are developed identifying symptoms and when employees are able to return to work. Now, we understand that some of those employees are coming up on that 10-day mark, and some of them can come back. And I want to stress that it has always been our plan all along to work with employees if there are issues associated with tertiary cases within their household, and that may affect us, in the short term. We understand that, and that's something that we'll have to get through.
Thanks.
So it's Zach Blanchard with New Center Maine again. Just want to confirm the final point you made there about possible cases within the household. So you're saying if a corrections officer has a family member who has tested positive as well, you're ensuring that they are not going back to work in the facility?
Contact is being made with the individual, and a determination is being made on an individualized basis. And I say that because we're aware of officers that have contacts or cases within their own household that, for one reason or another, can come back and want to come back. And so we're working with those officers to return. We are also aware of some officers who are cleared their 10-day mark, can return to work, but have concerns about individuals that may be under their care. We are extending to them on a case-by-case basis additional leave time to assist them in their response to caring for their loved ones. So if the question is, are we paying them? Yes, we are.
Greg, just what was the jail's policy for testing inmates sort of through this spring, like in terms of when they were admitted and released? And actually, similarly, just for staff, was there any kind of policy along those lines too?
And this was Charles?
Yeah, Charlie from the BDN. Yeah.
And it was regarding testing of inmates. I'm going to give you an overview and recognize that I might not have the full answer for you because as the guidance in the beginning came down, and I think one thing that we can all agree on is the guidance did change from time to time. And so at the beginning, I can't specifically tell you what happened in terms of the incoming tests. I can tell you that we did have a couple previously identified positive cases at the jail. Those were quickly contained. And so those didn't grow. We are testing all of the inmates now, and we are doing universal testing of our employees over there. Any employee prior to the outbreak, just to note, did have the ability to request a test of us, and we would promptly administer a test through our medical staffing and send that up. As it pertains to perhaps not the beginning and not what we're doing now, but what happened in the beginning or in the middle with inmates, we did perform some testing on inmates. I do know that. I cannot answer for you, Charles, to what extent we did that, but I'm going to find out, and I'm happy to follow up with you and anyone else here to get you a clear and concise response for what we did do.
Thank you. I appreciate it.
Are there, does anybody else have any further questions on this situation? You all received an email from me. If you have any questions, feel free to reach out, to me directly and ask for some understanding that it is very busy. It's a very dynamic environment at this point in time. I will do my hardest to be in touch with you. And if the need arises, we'll also do this again. I found it to be very helpful to answer your questions. Does anybody have any additional questions? Well, I'm not seeing any questions. I'm not seeing any additional folks raising a hand here on the Zoom call. I appreciate everyone taking the time out to tune in today and listen to me speak to you about the situation over here. And I look forward to speaking with you again. And again, if you have any questions, please reach out to me directly. Thank you.